Dear students, welcome back. In this session, we are going to discuss about rectum. Rectum is that portion of the alimentary canal between the pelvic colon and the anal canal. Pelvic colon and the anal canal. This is the part where the rectum is present. It extends from the rectosigmoid junction in front of the third piece of the sacrum. So behind it is having on the posterior aspect, sacrum is present. Okay, the third piece of the sacrum means the lower three segments of the sacrum is related to this part, and it is up to the anorectal junction, that is 3.75 centimeters in front of and slightly below the tip of the coccyx. Okay, so rectum is the portion of the alimentary canal between the pelvic colon and the anal canal. It extends from the rectosigmoid junction in front of the third piece of the sacrum to the anorectal junction, 3.75 centimeters in front of and slightly below the tip of the coccyx. If you see the total length of the rectum without anal canal, it is 12.5 centimeters and the diameter is 2.5 centimeters. If you see the external appearance, it is tubular organ, not of uniform caliber. The upper end is the narrowest part. So here in this pic you can see the upper end is narrowest part. The middle portion presents a dilatation called as ampulla. So the middle portion shows a dilatation called as ampulla. The lower end is narrowed once again. Again the lower end is narrowed once again. Okay, so the upper portion and the lower portion is the narrowed portion, and whereas the middle portion is dilated portion, that part is called as ampulla. If you see the curvatures of the rectum, it presents curvatures in both the antero-posterior direction. This one is antero-posterior direction, and also it shows some lateral curvatures. This one is lateral curvatures. In this pic we can see the lateral curvatures. If you see the antero-posterior view, that means side view, the rectum appears like this. Okay. So it is, now first we will see the AP curvatures. The upper sacral curvature. So this one is called as upper sacral curvature with concavity. So this is the concavity facing forwards, and a lower perineal curvature with concavity facing backwards. Okay, and so this one is the sacral curvature, which is the curvature, the concavity facing forwards, and the perineal curvature where the concavity is facing backwards. Okay, so this is the part with the anal canal. So this perineal curvature will continues with the anal canal, which is directed downwards and backwards, So this is about the AP curvatures. What are those curvatures? Sacral curvature and perineal curvature, and the facings of the curvatures are different in this. And now we'll see the lateral curvatures. There are three lateral curvatures. The upper and the lower having concavities towards the left. Okay, and the middle towards the right. So if you see the concavities, so that means left side and right, left side concavities. So these are left side concave. That means on the left side, upper and lower will have convexity on the right side. In the middle portion, we can see the convexity on the right side. This middle portion is the most prominent curvature we can observe. Okay, so these are all about the curvatures of the rectum. Now, if you see the relations, so the relations of the rectum. So this is the rectum. So this is the anterior and posterior relations. And this green part, this green lining is the peritoneal relations. Okay. Yes. The upper 1/3 of the rectum is covered with peritoneum, both in front as well as the sides. The middle 1/3 is covered with peritoneum only in front. So only in front only the peritoneum is covered. The lower 1/3 is not covered with peritoneum. Okay. Posteriorly, the rectum is related to 3 sacral vertebrae, 1, 2 and 3 sacral vertebrae and the coccyx. Okay. And these are the main relations, peritoneal as well as some of the bony relations to the rectum. And also some of the arteries like median sacral artery ending in front of the coccyx also related to the rectum, and also some sympathetic chains, so which end at the coccyx level are also related to the rectum. If you see the posterolateral aspect, it is related to the piriformis muscle and anterior primary rami of lower 3 sacral and coccygeal nerves, sympathetic trunks, and the lower lateral sacral vessels in the pelvic sacral foramen. So these are the some of the structures related on the posterolateral aspect. Anteriorly, if you see, the upper 2/3 is covered with peritoneum and it is related to the rectovesical pouch. This is called as rectovesical pouch, and its contents normally coils of terminal ileum and pelvic colon. Whereas the lower 1/3 is not covered with peritoneum and it is related to rectovesical septum. Septum is related. Okay. So in the case of females, what will happen? The upper 2/3 is covered with peritoneum and it is related to the rectovaginal pouch, that is called as pouch of Douglas, which also consists of coils of terminal ileum and pelvic colon. Okay, if you see laterally, upper 1/3 of the rectum is covered with peritoneum and is related to pararectal fossa, and lower 2/3 is related intimately to the levator ani and coccygeal muscles. These are the relations. If you see the blood supply is mainly by the rectal arteries. So one is the superior rectal artery, which is the continuation of the inferior mesenteric artery, and a pair of middle rectal arteries, which are the branches of internal iliac arteries, and also inferior rectal arteries, a pair of inferior rectal arteries, which are the branches of internal pudendal artery. Total 5 rectal vessels are supplying the rectum. Okay. If you see the nerve supply, okay. So if you see the nerve supply, both sympathetic as well as parasympathetic nerve supply to the rectum we can see. So sympathetic supply by the hypogastric plexus, whereas parasympathetic is by the pelvic splanchnic nerves. Okay, so this is about the nerve supply. Okay, if you see the interior structure of the rectum, so there are some walls are present called as Hosten's walls. Okay, Hosten's walls, these are the transverse foldings which we can clearly seen at this level. So these are transverse walls which are present, called as Hosten's walls, which are semi-lunar in shape along the concavity of the lateral curvatures. Along the concavity of the lateral curvatures, we can see these walls. They serve to prevent the ultimately descent of the fecal mass. So these are all about the rectum. Thank you.